What clinical parameters are associated with the reduced risk of type 2 diabetes and coffee consumption?
Coffee consumption can increase levels of adiponectin. This hormone has been shown to increase insulin sensitivity. Also, coffee consumption can decrease subclinical inflammation that underlies in this patient, in diabetic patients and in obese patients. It has been demonstrated that coffee can reduce the levels of some interleukins and the oxidative stress associated with isoprostane. So all these hormones or these mediators usually can be reduced by coffee consumption, and in that way decrease the insulin resistance that underlies in diabetic and obese patients.
What are the key findings from the research?
The key finding is that coffee is safe for obese patients, for diabetic patients, for general population, and even for persons with cardiovascular disease. It doesn't increase the risk of any chronic disease, and even it has been associated with lower mortality in general population and also in diabetics.
What evidence is there for a link between coffee and diabetic complications?
Coffee does not result in a worsening of diabetic complication, and it does not result in a worse metabolic control. So it is safe for diabetics. Even more, coffee is not associated with any chronic disease.
Can you comment on the association between coffee, cancer and diabetes?
Also, it is important to remark that coffee has been associated with a reduced risk of cancer. Some cancers, as for example colorectal, pancreatic, prostate, endometrium, and so some cancers have been reduced with coffee consumption. It is important because in diabetic patients have a higher risk of cancer, different kinds of cancer. So the finding that coffee reduces the risk of these cancers is very important for the diabetics.
So what are the implications of this research for diabetic patients?
There is no need for diabetic patients or obese patients to refrain of drinking coffee. It is no need, and it is very usual in the clinical practice.
What are your conclusions?
I would like to conclude that saying that maybe coffee is not as bad as it has been previously told.